So, Dr. Seema, would you like to add, because many women find it difficult to conceive when they are diagnosed with PCOS, and how do they? How do they deal with this when they're not pregnant?
So, polycystic ovarian syndrome makes pregnancy difficult, as I was mentioning earlier, also. Reason being, it affects
Right.
the oocyte quality, egg quality, as well as the soil where this uh, embryo is going to implant. And that varies as per their hormonal malaya and their metabolic profile. It's not only about that ovarian hormone which is taking its toll, is all the metabolic profile which this lady is having, as we all believe that polycystic ovarian syndrome is basically a metabolic disease. And all this frustration, I've told you that they get conceived, but the time frame it's taking and the toll, psychological, emotional, all this makes them depressed and anxious. So they
Mhm.
need a very positive atmosphere, especially at their fertility specialist. They have to deal with really tender touch. TLC is the key that should be having. And first and foremost thing, whenever a patient who's having polycystic ovarian syndrome comes to me, I try to make her understand what exactly she is having and how is she going to be. So
Okay.
once she knows her problem, no, then dealing with it becomes easier. And this counseling, this making them understand should be done with her spouse, so that he also knows. Sometimes patient understands that her treatment course is going to be longer, she might not be in normal hormonal ranges, sometimes androgens are just evoked, or sometimes her metabolic profile is not good, so that she's not ovulating. But the pressure from the spouse, not spouse, especially from the family, from the society, our favorite question is, when are you going to give the good news? So
Yeah.
that takes its toll. So if spouse does understand, it makes a lot of difference. And whenever this patient who has come to me after trying from so many places for 2 or 3 months, first month I try to do a natural cycle monitoring. I try to explain it to her. Look, let me understand where in that scale of severity you do land up, and accordingly we'll plan, and we'll go stepwise according to your age. Your Though you have so many eggs, but that age and biological clock is tickling the way it is tickling for everyone. So we have to go accordingly. We'll go stepwise. We'll take one step first, and we'll decide whether you are ovulating or not ovulating, and then how can we improve it. Then a stage comes when everything seems to be normal, but she's not conceiving, and like you have given one oral ovulation, she is ovulating, her husband, partner, and tube, everything is normal, then we consider her as an unexplained infertility. And sometimes, as we advise them to go for IUI. Not that IUI is going to do something different, but just to take away that tension, something is going on. And if all these things doesn't work and she is still in the age, sometimes I give them intro therapy. I just make them regularly menstruate for 3 months, starting progesterone from day 16 of the cycle for 10 days, and I send them home, and I'll tell them, now you need to go for the next step, so we'll take time. And sometimes, most of the time, they get pregnant, because that stress thing from the head is gone, that now she thinks that she needs IVF or she needs laparoscopy, this and that, for further treatment. And once that stress is gone, so many of them, they conceive, provided that they are following that all the lifestyle modifications and diet. So whenever you are just giving that diet and exercise regimen, that behavioral counseling and therapy is very important, so that she does stick to it, she doesn't get depressed and leave it that nothing is working. So I thought I have answered your question.
Yes, you did. So, with your experience, Dr. Seema,
Yes.
uh, do all women with PCOS need fertility treatment? I mean, IVF treatment?
No, not at all. Not at all.
So
Many-
that's what, PCOS,
Yeah.
the
Let me tell
misconception
you,
is.
if we just go on the scale of treatment, IVF comes as last or third line of treatment. First line of treatment is lifestyle modification. And I tell these young and obese ones that once you have lost even 5 to 7 kg, 5 to 10% of body weight, chances are their ovulation rate rises by 40% and their chances of getting natural conception is similar. So if you are just following that, you are lucky to have, you can have pregnancy by that. Then comes the role of oral medicines, which we give, and 30 to 40% people they get pregnant by that. Even if that is not working, then we go for sometimes IOI, or we look for other factors. Is there something else? We are just focusing on PCOS, PCOS, PCOS. Her tubes are not good. She might be having endometriosis or something else which is stopping this pregnancy, or husband factor is not as it is visible. So those factors are to be looked after. Sometimes for that we do their laparoscopies. If their ovaries are not very friendly, laparoscopic ovarian drilling is an option. If all these things fail, along with lifestyle modification and a favorite tablet every gynecologist, fertility specialist is giving you, known as metformin or these inositols, if all stop working, then comes the role of IVF. Yes, but as I earlier said, all these decisions has to be taken with consideration of the age of the couple, especially the female's age. If we have time and we have to tell them this is the way we control your hormones, then we try to make you pregnant. If you are not able to, we just repeat the process. But IVF is not always needed. But statistics says that if woman is older and like she's not conceiving, she wants a time to pregnancy, if you want to decrease 60 to 70% of these women, they might need IVF.
Okay. So just one small question. IVF is a very scary term for a normal person. So in a normal word, can you explain what exactly is IVF? Just in a
Yes.
normal words.
Yeah. That is my
Yes.
favorite part. I keep doing it every day. So, whenever I'm telling my patient, I just try to tell them the normal physiology, how does pregnancy and menses occur. So, I try to tell them there is one uterus, there are two fallopian tubes like our arms, and there are two ovaries. They are full of eggs pre-decided since your birth. And when you start menstruating, and after some time, every month, either from one side, one egg is selected and that gets matured inside a fluid filled follicle, and then it when it gets a proper size around mid cycle, it ruptures and that egg goes to the tube, and where it meets with the sperm and it fertilizes, and then after a few days it goes inside the uterus. In the meanwhile, uterus is just preparing its lining to receive this baby miniature form. So this is the normal pregnancy. What happens? IVF was invented for people whose tubes were blocked. So this meeting of egg and sperm, when it is going to take place outside your body, it is called in vitro fertilization or test tube baby. The work which tube was doing, when we are doing it in machine, we call it test tube baby. So nature is so perfect that pregnancy takes place or occurs by single egg. We are not that perfect. So we want 7 to 8 or 10 eggs to make that thing happen. So what do? We take this lady, we examine her. When we find her fit according to her reproductive potential, we put her on some hormonal injections. Those injections are the same thing which brain is sending as signal for that single ova to grow. So we are super ovulating them by giving that hormone in excessive quantity. Around 10 to 11 days of injection this lady receives. After that, and we keep monitoring their eggs in ultrasound, preferably by transvaginal scan. And when these eggs are mature enough, around 18 mm, 3 or 4 becomes 18 mm, then we give one more injection to just stimulate the thing of maturation. And then after 34 hours, giving them mild anesthesia, we take all those eggs out through a specific syringe under ultrasound guided, that is completely OPD based procedure. After that she goes home after 2 3 hours, and then we take husband's semen and we try to mix that inside the machine. When we are there, there are advanced processes now. One more advanced process of IVF is intracytoplasmic sperm injection. So sometimes we are just leaving these eggs in a petri dish in a special medium, and we are just putting that sperm semen sample washed and nourished one on that petri dish. And sometimes when we know that this lady might be having problem, or we look at the sperms, then we are trying to get it fertilized through the machine by doing ICSI or intracytoplasmic sperm injection. Then we keep it to grow in an incubator. That temperature and everything there mimics that of our fallopian tube. And once this embryo grows, we look at it. If it is perfect, then we transfer it inside the woman uterus. If everything is fine, that is a normal process. But in ladies with polycystic ovarian syndrome, either they produce no egg, or they are tend to make so many, and that makes their hormones go haywire. So in these ladies, for their safety, we are doing IVF in two step. In first step, we just make those eggs, we take it out, we create the embryos, and we freeze it. And the process of freezing is known as vitrification, and that is absolutely safe. And then we let this woman get periods, and after that we prepare her, or we follow her endometrial lining, and whenever she is ready in next or next to next cycle, we transfer her. By doing this, we have completely, almost completely removed all the complications these women are scared of, especially a complication called ovarian hyperstimulation syndrome and multifetal gestation. These are the two things in India. Multifetal gestation is not that a big issue. If you got a twin, so you just think one pay one free, that is a different thing. But in foreign countries, they are really concerned about twin pregnancies. So by doing this segmental IVF, first part you make and second part you transfer, FET cycle you started doing, this IVF process has become very safe for these ladies.
Wonderful. Wow, lots of insights. So thank you so much, Dr. Seema.